Nice introduction. So yeah, I'm excited to be here to talk about our core outcome set project for CTD and GAMT deficiency. Dr. Stockler gave a presentation on this at the last symposium, and her presentation is online on ACD's YouTube channel for anyone who wants to check it out. So I won't go over a lot of the details that she already discussed. I'll just give a brief overview, and then we'll dive into the updates and our findings. So the challenges with clinical trials is essentially there's a lot of variability in how these outcomes are measured or which outcomes are measured. And historically, patients and caregivers haven't been part of those discussions of which outcomes should be measured. And so they haven't always been the ones that patients regard as most important. And so what we set out to do, this project was led by ACD, and it was a collaboration between caregivers and health professionals. We wanted to create an agreed upon standardized set of outcomes that would be measured in every clinical trial for CTD and GAMT deficiency. And so there's currently no FDA-approved treatment for either of these disorders, but as we know, and I've been learning in the past 2 days, there are a lot of research studies ongoing. So I think it makes our core outcome set all the more relevant. And so there were 3 phases to our study. The first phase was the evidence review stage where we kind of took a 3-pronged approach. We looked at the literature to extract all the clinical and life quality outcomes. And we also conducted patient and caregiver focus groups to see what matters most to caregivers with regards to outcomes in clinical trials. And we also took data from the CreatineInfo patient registry. And so once we collated all those outcomes together, we had over 1,000 outcomes, and so that was still too many. So we took it upon ourselves to really try and prune the list of outcomes and get to our final number of outcomes, which is 85. And this includes all the unique outcomes that we had left after removing the duplicates. And so the second phase of our study was conducting Delphi surveys and asking families and health professionals to rate outcomes in order to reach consensus. And so in our first round, participants rated 85 outcomes. We had 90 patients and caregivers and 30 health professionals. And after data analysis, we went into round 2 with 81 outcomes, which again, all participants new and old participants were able to rate. And in round 3, we only had round 1 and round 2 participants who completed the survey, and they rated 50 outcomes. And this round was a bit unique in that they also ranked their top 10 outcomes. And so we had 63 patients and caregivers and 21 health professionals. And so the types of questions we had on our Delphi survey, participants rated the importance of every outcome from a scale of 1 to 9, and they also ranked their top 10 outcomes, as I mentioned, and this was unique to round 3 only. And this enabled us to be able to narrow down our list even more. And so in terms of participation, we had 21 health professionals who took the survey and 12 GAMT caregivers and 51 CTD caregivers. We had participants from all over the world. A significant portion of our participants were from North America, and we also had a big portion from Europe, Asia, Africa, South America, and Australia. So we used the stepwise inclusion criteria in order to really narrow down our list of outcomes, and an outcome moved to the next stage if it met all 3 criteria. So 70% of respondents of a group had to rate an outcome at 7 or higher, and the mean rating had to be 7 or greater. And we analyzed our data in 2 different ways. So we looked at caregiver rating as well as health professionals, but within the caregiver group, we also looked at CTD and GAMT deficiency, and this enabled us to really not let any one voice kind of dictate the results of the survey. And so the third step was if 15% or more of any stakeholder group included the outcome in their top 10. And so once we did this analysis, we were left with 27 outcomes that met the inclusion criteria. And before our consensus workshop, which was the last phase of our project, we had another meeting where we refined these outcomes even more, and we combined similar outcomes together, so adaptive functioning and daily living skills were combined together, and we also removed those already measured in clinical trials. This would include treatment safety and treatment efficacy. And so once we did that, we were left with 20 outcomes to be discussed at the consensus workshop. So the last phase of our study, which is the consensus workshop, comprised of a small group of survey participants who attended a workshop in Salt Lake City last year to help reach consensus on our final core outcome. We had 7 CTD caregivers, 5 GAMT caregivers, and 13 health professionals who attended. And so we first started the meeting by reviewing round 3 survey findings and talking about the outcomes that were left, and each participant had a minute to talk about their top 3 most important outcomes, and this is what we referred to as an adapted nominal group technique. And then a group discussion kind of began after that, where each outcome was discussed in depth. And participants then voted on an online form, and they discussed the results of the voting and came to our basically core outcome set. So the way that they voted, they had 3 choices for each outcome: definitely in, 2 maybe, and definitely out. And so they had a maximum of 5 outcomes that they could rate as definitely in, and any outcome that received 50% or more of the votes was included in the core outcome set. And this is our final core outcome set for CTD and GAMT deficiency. As you can see, 8 outcomes made it to our final list. So I will note that emotional dysregulation and fine motor functions didn't initially meet our 50% or more criteria. So after discussion among the consensus workshop participants, they unanimously agreed that they would want to include that in the core outcome set. And expressive communication was previously termed expressive language, but it was changed to expressive communication in order to accommodate other modes of communication, so assistive devices, sign language, etc. And you'll notice there's a star next to MR spraying creatine. This tends to, it may be normalized in GAMT deficiency patients who've received oral creatine supplementation prior to starting a trial. And in regards to serum plasma guanidino acetate, this is strictly for GAMT deficiency trials, as it's a hallmark of GAMT deficiency, and it tends to be normal in CTD patients. So we had 3 other outcomes of note that didn't actually make it to our core outcome set, but participants still thought that they were more worth noting in clinical trials. So serum plasma creatine and MR aspirin guanidino acetate could be noted in GAMT deficiency trials for monitoring oral creatine supplementation, and MRI brain general tends to be typically measured along with MR aspirin. So it could be useful to note any abnormalities with this outcome as well. So next step, we're currently preparing a manuscript for publication in a peer-reviewed journal, which will be free access, hopefully, to everyone. And ACD actually just is starting a second PCORI-funded project where they're wanting to look at outcome measurement tools. And so we don't want this core outcome set to kind of sit on a shelf. We want to be able to recommend tools that could be used to measure these outcomes in order to hopefully have it be used in clinical trials. And for anyone who's interested, ACD has posted a report on our core outcome set project with a list of all our outcomes and some definitions and explanations. So you could just scan the QR code in order to learn more. And I just wanted to thank everyone who was involved in the study. Dr. Sylvia Stockler, who really wanted to be here and unfortunately couldn't make it. Of course, Heidi and Dr. Thurm and Emily, who were really integral. And our advisors, Maureen Smith, Beth Potter, and Allison Howie. And of course, our parents and caregiver collaborators who were really integral to the success of our core outcomes set development project, and all the health professionals who participated in the Delphi surveys and the consensus workshop. Thank you.